Welcome to this clinical walkthrough on a workplace harassment and safeguarding case for UKMLA, brought to you by Mediate, your 24/7 practice partner.
So let's dive right into this OSCE station. We're going to break down the consultation into 6 clear stages. This gives you a repeatable framework, so you know exactly what to do every single time. Okay, first things first. Your absolute #1 goal is to create a safe, confidential space. If you get this right, your patient will open up. Get it wrong, and the entire consultation can fall flat.
Here's your setup. You're an FY2 doctor in a GP practice. Your patient is a 20-year-old who comes in simply saying, "I want to speak to a doctor." You know, that vagueness, that's your first clue that something sensitive is going on here.
You'll start with a warm, open introduction. Something simple like this, combined with open body language, is your first step to building that all-important rapport.
Now, if the patient is hesitant, you need to offer direct reassurance. Using a phrase that explicitly confirms confidentiality and safety can be the key that helps them trust you.
Right. Once the patient discloses what's happening, your role shifts. Now you need to systematically explore the nature of this harassment to get the facts straight. And this is how you do it. You start with empathy, a simple, "I'm sorry to hear that." Then you follow it up with a gentle, open question. This lets you gather more detail without sounding like you're interrogating them. You have to ask these specific questions. They help you build a clear picture of the context, the timeline, and just how severe this is. All this information is absolutely crucial for assessing risk and creating a solid management plan. Okay, now we're moving beyond just the complaint itself. You have to assess how this is affecting your patient's physical, mental, and social well-being. This is where you shift your focus from the problem to the person. Use this 5-step process to get a full impact assessment. You're checking for emotional and physical symptoms, understanding their ideas and concerns, figuring out their support system, and screening for any risky coping mechanisms. This ensures you don't miss anything critical. Listen for these physical signs of psychological distress. When a patient says something like this, it's a significant finding. You're connecting their workplace stress directly to a physiological response, a classic anxiety symptom. And then this comes out. She's drinking a bottle of wine every single day to cope. This is a huge red flag. It's a major safeguarding concern, and it has to become a central part of your management plan. Remember, you can practice this exact case right now and get objective feedback on mymediate.com. All right, let's move to a crucial point. You must explicitly validate the patient's experience. You have to name what's happening. Using this exact phrasing is so important. It shows you're on their side, and it empowers them, helping to shift their mindset from feeling like a victim to someone who can actually take action. So, the management plan has 2 key parts. First, you empower the patient with knowledge about their rights. Second, you provide direct medical and psychological support. You need to explain that what's happening to them is actually illegal under the Equality Act 2010. Naming the law gives your validation real weight and shows them there's a formal system in place for protection. You're going to outline the practical steps the patient can take. This gives them a sense of control and a clear path forward. You are arming them with options. Now you detail what you are going to do as their doctor. This shows your commitment and directly addresses the health impacts of the harassment. You aren't just giving advice, you're actively intervening. Look, a single consultation is not enough here. For a safeguarding case like this, establishing a clear safety net and a solid follow-up plan is absolutely mandatory. Your plan must include these 2 essential actions. Scheduling a follow-up provides that continuity of care, and escalating to a senior colleague fulfills your critical safeguarding duties. These are non-negotiable. This entire case highlights the link between discrimination, mental health, and harmful coping mechanisms. The most critical element is recognizing that link. Your job isn't just to manage symptoms, it's to identify this connection and intervene safely and effectively. You can practice this exact case now on mymediate.com to master your approach for the UKMLA exam.